صلى الله عليه وسلم وعلى آله وأصحابه ومن والاه. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Alhamdulillah, all praise and thanks are due to Allah subhanahu wa tabaraka wa ta'ala, our nourisher, our sustainer. May Allah subhanahu wa ta'ala bestow His peace and blessings upon our master and leader, Nabi Mustafa Muhammad sallallahu alayhi wa sallam, on his family and friends, and on the entire ummah until the end of time. Ameen ya Rabbal Alameen. Alhamdulillah, indeed, it is a great pleasure and honor for me to introduce our guest speaker for today. It is Dr. Saadiq Kariem, and Dr. was appointed as the Deputy Director General Operation for the Western Cape Government Health Department on the 1st May 2020. Dr. is also a qualified medical doctor who prior to his appointment was serving as a Chief Director of the Emergency and Clinical Services Support Component. Beyond his medical degree, Dr. also holds the following qualifications: Master of Philosophy in Public Health, Executive Masters in Business Administration, and Fellowship of the College of Public Health Medicine, South Africa. And Alhamdulillah, I'm honored that Dr. is here today as well. Alhamdulillah, I'm proud to say I performed Doctor's nikah a few years back. Alhamdulillah. And also Doctor's father, very active in the MJC for many years. We make dua that Allah subhanahu wa ta'ala grant Hajj Kamal, his health and his strength. Ameen ya Rabbal Alameen. He's quite at a good age by now, and he was very active at the MJC for many years. So we make dua that Allah subhanahu wa ta'ala grant Doctor's father Hajj Kamal, his health and strength. Ameen ya Rabbal Alameen. So without further ado, inshallah, I'll hand over to Doctor.
Yes. Shukran. Mask off? Okay. Shukran, Sheikh, mashallah. I think it's safe enough to take my mask off. Okay, people are outside also, I believe, and I've been asked just to project my voice as well. And shukran for the good dua on my father, Hajj Kamal. May Allah Ta'ala grant him shifa, inshallah Ta'ala. Before I even start, I see one of our first vaccinees is also in the masjid, and when he's done making his sunnah, inshallah, we'll ask him to stand. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Alhamdulillah rabbil alameen, wa salatu wa salamu ala ashrafil mursaleen, sayyidina wa nabiyyina wa maulana Muhammadin sallallahu alayhi wa sallam. Rabbi shrah li sadri wa yassir li amri wa hlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. This is an important topic that I'm going to talk about today. I'm going to try, and people outside, I believe there's a lot of people outside. Mr. Chawan can just indicate if my voice must be raised a little bit, but I hope you can all hear me. Vaccines. I'm going to talk about the importance and access to the COVID-19 vaccination program. And perhaps just before I begin, I'm going to hopefully try, in the process of going through some of the facts and information, try to debunk some of the myths around vaccines. There are a lot of myths out there. I'm going to try and convince people there's no 5G attached and associated with the vaccine. There's certainly no chip inside the vaccine. The vaccine is not trying to depopulate nations. And certainly, there's no conspiracy to steal information. And these are some of the myths that are out there amongst our community. And for that reason, I was invited just to address the community, inshallah ta'ala. Also, just to say, I'm not going to talk specifically about whether it's halal or not. I'll leave that to the esteemed ulama. This issue has been addressed as well on the Isnad Academy talks by Mufti Tawak Haran. And members of the community, I'll encourage you to in fact go onto the Isnad Academy and to in fact look at some of the talks there. We have a group of esteemed colleagues of mine who are on this and talk to an issue about vaccines, and I also have their permission to use some of the information. So first of all, vaccination itself has been around for decades. You will all remember when we were children, and some of you might have to remember a little bit further back than others, but we were given the polio drops in our mouths. We had our measles vaccines, we had a whole range of vaccine shots that were given to us as children. And that's actually quite important and quite crucial. So the COVID-19 vaccination is not unique in that sense, because we've been given vaccinations for decades. Now, I know that there is a narrative in the sense that there's some harm that comes from the vaccination. But just by estimation, in terms of estimation worldwide, about 2 to 3 million deaths have been averted because of the vaccines that we've been getting as children already. And possibly another 1.5 million deaths could have been averted had the vaccination programs, in fact, been a little bit stronger. We know about the measles and the reduction in measles. Polio is virtually almost eradicated around the world because we've been vaccinating our children with polio, against polio for many, many decades. So vaccination in itself is not unique. That makes sense. Maybe on that one. Okay, there we go. That makes sense. And it doesn't scratch. But besides just the deaths averted, there's also the issue of morbidity. In other words, people who get ill from the vaccine and preventing the morbidity. And that's also quite critical. If you will remember from polio decades back, for those who are a bit of the elderly now amongst our community will recall the polio paralysis that we often saw children live with. And so there's quite a high degree of morbidity. By that I mean those kind of issues. People don't necessarily die, but there's severe effects on the health and disability that results from that. And so I think that's also quite an important feature. But to come specifically to the vaccination around COVID-19, and I'm not going to talk about COVID-19 itself, but just focus the talk on the vaccine. We'll recall that the country had initially purchased 1.5 million doses of the AstraZeneca vaccine that's made by the Serum Institute in India. It was called Covishield. That's the name that we gave that vaccine. And that vaccine landed in the country, and we had quite a lot of publicity around that vaccine. And the vaccination, in a sense, does represent a new hope. Just as we were about to roll out the program of the AstraZeneca vaccine, the results were published of the Johnson & Johnson vaccine, called the Ensemble Trial. This was a massive trial conducted across 4 continents, the USA, the Latin Americas, as well as South Africa, of over 44,000 participants. In fact, 44,325 participants participated. And those results were actually quite significant. And you'll remember that these results were then presented by the minister and the professors on one Sunday evening. And the results, in fact, changed the direction that the country was moving around in terms of its vaccination program. That study, before I get to the results very quickly, but that study was conducted in South Africa at the time when we were dealing with the new variant, the one that's known as 501YV2. Because of that, and because the study was done at the time when the new variant was prevalent and the predominant variant in South Africa at the time, obviously those results are really quite crucial, and that's been key to the change in the direction towards the Johnson & Johnson vaccine. The study population had included people with comorbidities as well as people with HIV. So there's quite a wide range of participants in the trial. And the results essentially showed that while this vaccine, Johnson & Johnson one, did not essentially protect against mild COVID disease, it did protect against moderate and severe disease by 57%. The efficacy for that was 57%. There was also an 85% protection against severe illness and a 100% protection against death. And so those results are obviously self-evident. And for that reason, the country changed direction, and we are now busy implementing, and we have begun rolling out the Johnson & Johnson vaccine. And that's where we are at the moment. Obviously, there's a licensing process that has to continue through the country. And another myth, in a sense, is that this is a trial, it's a study, and are we being used as guinea pigs, etc. The vaccine has been shown to be effective. The efficacy of the vaccine is not in question. Those results that I just shared with you now proves that. What we are looking at, in a sense, is an implementation trial where essentially we want to look at certain clinical outcomes. And that's currently what we're doing at the moment as part of this research trial. So we're not testing the efficacy of the vaccine. We know it works. We know the results. And at the moment, we're obviously rolling out as part of the research trial. And so that's what that is. But perhaps to get a little bit more into the content of a vaccine, because people talk about the 5G link, and is there a chip in the vaccine? And Dr. Lario was our very second healthcare worker in the country to be vaccinated with this vaccine. Himself also spoke a little bit about it, and I think it was him that I saw coming in. Was it? Was he? Oh, is he? Somewhere. Yeah, he's hiding. He's very shy. The way the vaccines are generated, are made, in a sense, let me put it that way. So what they take the COVID-19 virus and essentially splice the protein off from the virus, called the spike protein. That protein is then inserted into another virus. But the virus that is inserted into, neither the virus nor the part of the piece of genetic material that's inserted into it, neither can cause illness. I think that's quite key, because that often drives a lot of the myths around vaccination. Neither of those can cause illness. So now you've got a spliced part of the coronavirus into another virus, which effectively becomes nothing more than a transport mechanism into the body. And that's how that's the mechanism, biology behind the Johnson & Johnson vaccine, as well, in fact, as the AstraZeneca vaccine. And that then primes your body to develop the immune response. And that's essentially the basic science behind that. Now, obviously, it's very complicated, and if you go onto the Eastnard Academy site, you'll understand from my colleagues there, but exactly just how complicated it is, who are specialists in vaccinology and all vaccine-related matters. But that, in essence, is basically how it works. So there's no chip that's inserted. There's certainly no magic link to 5G or any other 3G network that one thinks about. And there's certainly no information that gets recorded or coded into the vaccine. I think some of the confusion also probably arises in the transport vector. It's called a vector virus mechanism. That's basically what it's called. The Johnson & Johnson vector, in a sense, is an adenovirus. It's a human virus, a virus that normally does affect humans. The AstraZeneca vector virus was a virus that was originally, that's mostly found in chimpanzees. And that is another one of those myths that people have been one reads on the social media, that's some animal type of virus that's being injected. But the important thing to understand is that it's simply a transport mechanism for ensuring that the genetic material from the coronavirus, from SARS-CoV-2, is in fact inserted into your body so that your body mounts an immune response. So it kind of primes your body, almost like kickstarts the body, if you like, to develop an immune response. So that's the basic science behind it. And I thought it's probably important to explain that. There is a difference with the Pfizer vaccine, and probably have a little bit of time. There is a difference with the Pfizer vaccine. It's a slightly updated and different mechanism used in order to mount that immune response. But essentially, that's how viruses work. In the Pfizer vaccine, essentially, that genetic material is inserted into a bubble of oil, and that's how the transport mechanism, basically, through that, is inserted into your body. So the mechanisms are slightly different. But that's behind some of the science behind the vaccine, and I hope that primarily will serve to debunk some of the myths that have been going around social media and amongst our people in terms of understanding the vaccine and how it works and how it in fact functions and operates. So at the moment we are looking at implementing and rolling out the Johnson & Johnson vaccine. There are 3 phases of this vaccine rollout. The first phase is what we currently are in the moment. It's phase 1. It's where we only want to vaccinate healthcare workers. And within the definition of healthcare workers are, for example, people who are on the front line. And by that we mean healthcare workers from my colleagues who are patient-facing, who actually see patients clinically as part of their daily duties. And these are the group of people we want to vaccinate first. In the second phase, that's when we start rolling out a little bit wider And we've identified certain categories of people in phase 2. For example, those who are older than 60, but basically people who are vulnerable, those with comorbidities, essential workers, and so forth. And so that's the category phase 2, and it will depend upon when the commercial production of the Johnson & Johnson vaccine is scaled up enough to be able to come into the country so that we can in fact begin the mass vaccination of our population. Obviously, it's hard to estimate when that will be. There's lots of, as we speak, negotiation happening at national level by the national government with some of these manufacturers, obviously, to determine when that commercial production will in fact reach South Africa so that we can begin phase 2. Phase 3 will then follow from that. That's where we will vaccinate everybody who's older than 18 years old. And the reason for that really essentially is obviously still further studies need to be determined about vaccine efficacy in those under 18 years old. So in a sense, that's what we've begun. And in the Western Cape, we have currently 4 sites in the province, in the metropole. And as of Monday week, we're in fact going to be rolling out and expanding that to 7 sites. And then the 3rd week after that, we're going to be expanding it to 7 more sites. The vaccines are arriving in the country as part of the cohort of research vaccines in tranches of 2-week periods. And those 2-week periods essentially is what we use the vaccines for. And then we obviously get another tranche coming in, and we'll do 4 such 2-week periods over the next 8 weeks. And also important to realize is that there's a very clear sequencing criteria that we've developed. In other words, when we've got so what we decide to do is we allocate pro rata according to the doses we receive in geographic areas. We allocate pro rata between the public and the private sectors of our province. And then within the geographic area, we allocate obviously pro rata to facilities according to the number of healthcare workers that they have, and also according to the vulnerabilities of people. And I think that that's quite important, and obviously one can appreciate the immense logistics that goes into such a program and such a rollout, and the speed at which this had to be scaled to try and get to quickly enough to phases 2 and phases 3. And we're obviously scaling fast enough because we really want to make sure that as far as possible we blunt any potential 3rd wave that might come. And remembering in terms of estimation, always hard to estimate accurately when that 3rd wave will come. But initially our thoughts were that it'll probably be sort of May, June type of period, when we also have our winter, and our winters in Cape Town, as you all very well know, we also combine often that with our influenza season. So right across the country, and in this province is no exception, we're in fact working very hard to scale the implementation and rollout of the vaccine program. And so that's why we're working exceptionally hard. We are also from next week starting to roll that out across the rural areas as well, so that we get a wider spread. And in the last minutes that I've got, I want to deal perhaps with some common questions and some other common myths, I guess, that are out there. We often get asked as healthcare workers, okay, so what are the side effects that one can expect from this vaccine? I thought we'll just address that very quickly as well. The more common side effects are obviously you might get a bit of fever, you might get a bit of, sometimes you can get a bit of pain at the injection site, obviously you're one's using a needle, you might get a bit of muscle aches, you might get a bit of headache. And more commonly, the side effects will begin roughly about 6 hours, will peak at about 24 hours, and hopefully will resolve after about 3 days, within 3 days at least. And so those are the more common side effects. Other side effects are extremely rare, like a severe allergic reaction. We have already done just under 8,800 vaccines as of 5 p.m. last night, and I can tell you that there's been no severe side effects so far. And like I said, we've got one of the Musalis in here who in fact been the 2nd healthcare worker in the country to receive that vaccine. And so that's part of the side effects are often what people fear. Another question we often get asked is how long after taking the vaccine will one be protected? Obviously the science around that and what we take the guidance from the researchers and from the scientists around that, but it roughly starts at around 2 weeks after having received the vaccine. And that's why it's important to differentiate between the symptoms of COVID and the symptoms of a reaction to the vaccine, the mild symptoms. And for that reason, we often advise people if it's within that time period to rather just speak to a medical professional and just we can take advice from there. Another important issue obviously is in terms of travel. If one just looks at what's happening around the world, I'm specifically raising that because of the issue of Hajj, inshallah ta'ala, when that's possible for more people. Most countries would probably require proof of vaccination. And for that reason, we've in fact developed a little vaccination card to prove and to show that that you've been vaccinated. And so that's generally what you'll carry around with you. And for those who've had the opportunity, mashallah, to be on either Hajj or Umrah, you'll know that sometimes you get asked for the yellow fever card. It's a similar type of card. We're using those kind of cards. And so there's no magic information we're hiding inside of those cards, which is another myth that one often hears around it. There's a lot of personal information that's being shared. In terms of just where we are going, I suppose in coming towards the end, Sheikh, the intention is in the future of this is that we will be rolling out the vaccine, like I said, over the first 8 weeks as part of the research trial, and thereafter, inshallah, we will in fact be vaccinating the community at large. There's been a lot of people trying to register on the website. There's a website that we have for healthcare workers. It's healthcare workers only who are meant to register on that website. And people have been trying to register on that website. You will not be able to receive your vaccine because at this stage you're not a healthcare worker. That obviously will open up to the general population as we move towards phases 2 and phases 3, inshallah ta'ala. And I suppose in closing, I think the most important issues that I want to emphasize and stress in a sense is that one, you must always make sure that we still continue to protect yourself and protect others. And you've heard this many times before, and I'll often repeat it. I'm going to repeat it again to say that don't forget to wear your masks, don't forget to keep physical distance, don't forget to wash and sanitize your hands. I'm specifically using the words physical distance rather than social distance, although that's in the large narrative of people is social distance. There are different ways one can communicate. MashaAllah, as mentioned by Sheikh, my father's 82 years old, and even he had to learn how to use, WhatsApp, with video call on WhatsApp, MashaAllah. So there are ways in which we can communicate, and I think that's quite important. Avoid gatherings as far as possible. Avoid close contact, avoid confined spaces, and avoid crowded places. I think that's really important that I want to stress. We have heard and seen of community people having weddings, even janazas. Be careful when one attends a janaza, that one maintains the social distancing. MashaAllah, I'm pleased to see, Sheikh, that in this masjid, we can see that that's being adhered to as well. And then lastly, an appeal from my side is to shield the vulnerable, shield the elderly, shield those with comorbidities, inshallah ta'ala. We'd like for our elderly, and particularly our parents, inshallah, that they remain with us for a long time still. Allah grant them, inshallah, a long umr still, and shifa, amin, inshallah ta'ala. I've been asked to close at just about 10 past, and so I will end with that, Sheikh. Shukran for the opportunity to address at least some of the concerns and some of the myths. Jazakallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. I very seldom come and speak in front, and I promised that it's going to be on at least once a year. And that time is normally, sorry, Doctor, please come and sit here. Please, Dr. Saadiq. I always say it's only once a year, and that is during December, when I've got to give an announcement on behalf of the masjid and all of you for the immatriculants. But before I do that, I must say that we are very, very, very fortunate in this masjid to have a person of the caliber of Dr. Saadiq Kariem to address us. He is in the front line relating to the rollout of vaccinations and vaccines in the Western Cape. He heads that whole program in the Western Cape. He makes sure that the vaccine centers are also fully geared to deal with it. Let me remind you of a date last year, the 6th of March 2020, before the announcement of the first COVID coronavirus case in South Africa, we at this masjid read out a statement to everybody to inform you of the seriousness of this particular virus. We warned you of the fact that what's going to happen. And when we told you about social distancing, masks, crowds, etc., a number of people were laughing in this particular congregation. And we actually said in the masjid notice, this is not a joke. Please don't laugh. Today we can see exactly what the status quo is. When number of our family members have died, number of our family members have been hospitalized, number of our family members got COVID, schools are not operating fully, they have half today, half tomorrow, offices are closed, and we'll be having a situation where they're doing things online. That's the situation. But the vaccine is there to help us. And I would ask at this stage, Dr. Anis Ismail, would you please stand up this time, please? He's the head of the Melamed Trauma Unit. Turn around and let people see. And he was, on the same day as the president got his vaccine, he was invited to give the vaccine, and he's very much alive. No chip in him, no conspiracies in him. He's very much alive and working today. So this Jumuah, we always try as a committee, Islamia College Masjid, to bring contemporary topics. And today, we're the first in South Africa to have a leader from our community, a leader in the Western Cape, giving us a presentation on vaccine, the importance of vaccines and access thereto. On behalf of Masjid al-Furqan and all of us here, we announced that the matric results came out last week, in this week, and alhamdulillah, our Muslim schools overall have done very well despite the unprecedented challenges they had faced throughout the year. We had our matriculants always here occupying this part. For a large part, they were not in the masjid, we were not in the masjid. When we came back, they were not here because they couldn't come to school. They were doing everything online, but yet they are part and parcel of this masjid. We are pleased, honored to announce that our Islamia College matriculants have attained 12A aggregates and 153 subject distinctions. Alhamdulillah. This includes 5 matriculants who attained distinctions in all their subjects and 5 students who obtained 5 or more distinctions. Brilliant results, very good effort. It shows the standard of education at Islamia College, and we the masjid are part of them, they are part of us, and we must say alhamdulillah, our school, and I'm saying this to the chairman, Mr. Nazir Osman, on behalf of this Jamaat, the committee, we say our school has done brilliantly. Please convey what we have said today from this member, from this podium, to your learners and to your teachers and to your administrators, more particularly Sheikh Saadullah Khan. Besides the matric results, Islamia College also produced 5 Hafiz students who completed the Hifz al-Quran during this pandemic, memorized the Quran and completed it. Though Islamia is saddened by the loss of the principal of the boys' high school, Mr. Shaheen Khalant, and the educator, Mrs. Nazli Reynard, may Allah grant them Jannat al-Firdaus. We applaud the achievements of our students, our family, these students are, who have attained success while experiencing the trials of the pandemic. Often being taught online and having to learn with social distancing, which is so difficult for children, yet they managed. We wish and pray all our students success in the future endeavors, inshallah, shukran. And I'll just for saying, we haven't even touched of our alumni who have qualified at Islamia and graduated and got their degrees at different universities, be it medicines and all the different. Today, number of Islamia students, in fact, are professors at universities teaching students. Last week we had Sheikh Abdullah Bayat, who was a matriculant here, and when we were going out, he tells me his sister, Amina Bayat, who also matriculated, both of them got professorships at University of Western Cape. This is the standard of education Islamia has produced. Sheikh and Jama'a, Jazakallah khair. Assalamu alaikum wa rahmatullah.